Hello, I'm Dr. Goh Xueying, and in this video, let me share with you about infections that affect our ears. We can get infections in all three parts of our ear: the outer ear, which includes the auricle or pinna that's outside our head, and the ear canal, the middle ear, and more rarely, the inner ear. The most common type of ear infections are external ear infections. These can be very painful and could happen after swimming or when we dig our ears. Sometimes the ear feels blocked and you feel like you can't quite hear. Infections also happen in auricle or pinna caused by accidental injury from trauma or intentional injury such as a ear piercing or a cyst in the ear. Our middle ear is connected to the nose and throat. Middle ear infections usually occur together with an upper respiratory tract infection and are common in children. Patients with a damaged eardrum may also get middle ear infections. This occurs when the ears get wet. Bacteria enters from the external ear to the middle ear through the perforation. Sometimes chronic middle ear infections are caused by an underlying problem, for example, a negative middle ear pressure or cholesteatoma. Negative middle ear pressure causes fluid accumulation in the middle ear and chronic infections, and it can be related to pathology in the nasopharynx and nose. Cholesteatoma is a tumor-like growth of skin in the middle ear. It can cause destruction of the middle ear and surrounding structures, and the symptoms often include chronic ear infections and discharge. Inner ear infections are uncommon, and symptoms include hearing loss and dizziness. They are usually caused by viral infections or spread from a pre-existing middle ear infection. Most ear infections require medical treatment, as complications like abscesses and brain infections could develop, especially in patients with diabetes or other chronic medical conditions. So please, go to your family doctor or an ENT specialist if you suspect you might have an ear infection. Your ENT specialist will use an otoscope or a microscope to examine your ears. The doctor may clean out your ear to see the ear canal and the eardrum better before both are examined. The middle ear, which is behind the translucent eardrum, will be checked as well. Your doctor may want to do hearing tests using a tuning fork or pure tone audiometry to evaluate your hearing. The treatment varies depending on the type of ear infection. An external ear infection is usually best treated with topical antibiotics, while the treatment for middle ear infections includes a course of oral antibiotics. In some cases, the ear is so full of debris and discharge that the ENT doctor will clean it to relieve discomfort and hearing loss. It reduces the infection load and to allow any eardrop treatment to reach the infected areas. In rare cases, ear infections may develop into abscesses, brain infections, or infect the bone around the ear. These conditions require urgent surgical intervention, intravenous antibiotics, or both. Your ENT specialist may recommend surgery if you suffer from chronic or recurrent ear infections that do not get better with medical treatment. For patients with middle ear infections that do not respond to medical treatment, a tympanostomy tube may be inserted to the eardrum to drain the pus and infected material. For patients with chronic middle ear infections caused by eardrum perforation, an eardrum repair surgery may be done to prevent recurrent infections. And finally, for patients with cholesteatoma or mastoiditis, an infection of the mastoid bone around the ear, a mastoidectomy surgery may be needed to remove the disease from the mastoid bone and middle ear. Ear infections may be avoided by not using your fingers or instruments to dig your ears. Most of the time, your ears do not need cleaning. They are supposed to be self-cleaning. If you have a eardrum perforation, practice dry ear precautions like using earplugs when swimming or showering. If you think you have a ear infection, please see your GP or ENT doctor. A simple infection can become serious if you leave it untreated. Thank you for watching.